So to do a pelvic floor contraction, or Kegel as a lot of us refer to it as, I want you to think about the anatomy of your pelvis. So you're going to think of your pubic bone here, your tailbone in the back, and then your two sits bones. So together that will make like a baseball diamond. So I want you to picture the muscles in between there, and you're going to link that with your breath. So when you inhale, you're getting that nice belly breath and the ribs coming out. The intra-abdominal pressure should then make your pelvic floor elongate. So you're gonna inhale, feel the pelvic floor elongate, and as you exhale, think of drawing in that baseball diamond, drawing in between your sits bones, the pubic bone, and the tailbone to draw in and up gently. It'll almost feel like an elevator. So think of closing the elevator doors and gently drawing up. And then as you inhale, you're gonna gently relax the pelvic floor and bring it back down. So you inhale, pelvic floor elongates, and exhale, Kegel, squeeze up and in, drawing that elevator up. Inhale, slowly let it back down. So it's not like you're inhaling and just dropping it. It can be really nice to visualize like a grain of rice, and you can even break this down per parts of the pelvic floor. So inhale, drop the pelvic floor, and as you exhale, think of picking up a little grain of rice with your urethra. Inhale and drop the grain. And then you can think of inhale, drop pelvic floor, exhale, pick up, let's say a pea with your vagina or your cervix. Inhale, drop it. And then same thing with your anus. Exhale, pick up a grain of rice. Inhale, bring it back down. And then we can bring that all together. Get all three of the grains of rice or whatever it is you want to visualize. Inhale, dropping the pelvic floor. Exhale, pick up all the grains of rice, bring them in, and slowly drop them back down. Okay, so obviously I can't be sure if you're doing this correctly without seeing you. That's where the pelvic physical therapy would come in, where I can actually go in and check you. But you can check at home if you, let's say you're in bed, and just kind of prop yourself up like this and take a hand mirror and place it so that you can see your pelvic floor. As you inhale, you should be able to see an elongation, like a bulge of your pelvic floor going down towards your feet. It's not going to be huge, but you should see some movement there. And then when you exhale to do that pelvic floor contraction, you should see a closing of your vaginal and anal openings and drawing in. And you'll be able to tell if it's drawing in because you should see your clitoris nod down. If your clitoris nods up, then that likely means that you're overcompensating with your transverse abdominis through here. So it's really important to make sure that everything's kind of grabbing and gently pulling in. Okay, so just take a mirror, check it out. If you have questions, you're always welcome to message me and I can kind of walk you through some extra cues. Different cues I like are, if you imagine a really thick smoothie and you're gonna suck up that smoothie through a straw into your vagina. Another fun one is, if you think of a turtle head poking out of your vagina, you wanna grab the turtle head and pull it back in. So try those different ones out. Different things are gonna work better for different people. And also keep in mind, check in with the rest of your body. What are your adductors doing? Are they firing? Because they should be relaxed. What are your glutes doing? Are those firing? Are you squeezing your glutes in order to try and get that pelvic floor contraction? Because you don't want to be doing that. You want to really be focusing solely on the pelvic floor and be able to isolate those movements. All right, give it a try.